Hello friends, welcome to AI Medical School. In this video, we are going to talk about ciprofloxacin, which is the fluoroquinolone antimicrobial agent. But before getting started, if you haven't subscribed to the channel, so subscribe to it and like the video. Now let's get started. Ciprofloxacin is a fluoroquinolone antimicrobial agent with a broad spectrum of activity against both gram-negative and gram-positive bacteria. They are relatively non-toxic and well-tolerated broad-spectrum agents. Their excellent bioavailability permits their use for the treatment of a variety of serious bacterial infections. Antibiotics require a constant drug level in the body for therapeutic effect. This is achieved by taking the medication at regular intervals of time throughout the day and night as prescribed. Ciprofloxacin is important to take the drug for the full time period as prescribed. If you discontinue the therapy, it may result in ineffective treatment. Now the indications are: ciprofloxacin is primarily indicated in conditions like acromegaly, short-term treatment before pituitary surgery, chronic prostatitis, GL infections, gonorrhea, iron deficiency anemia prophylaxis, or for mild iron deficiency anemia with chronic renal failure, most other infections, muscle relaxation, long duration, for surgery and intubation, muscle relaxation for surgery or intubation, osteomyelitis, pseudomonal lower plus RTI and cystic fibrosis, respiratory tract infections, sexually transmitted disease, sexually transmitted infections, skin infections, skin structure infections, status epilepticus, unlicensed use, surgical prophylaxis, and urinary tract infection. Now contraindication: ciprofloxacin is contraindicated in conditions like epilepsy and hypersensitivity. Now, side effects: the severe or irreversible adverse effects of ciprofloxacin, which give rise to further complications, include pseudomembranous colitis, hearing loss, seizures. Ciprofloxacin produces potentially life-threatening effects which include anaphylactoid reactions, Stevens-Johnson syndrome, acute renal failure, fulminant hepatic failure, epidermal necrolysis, which are responsible for the discontinuation of ciprofloxacin therapy. The symptomatic adverse reactions produced by ciprofloxacin are more or less tolerable, and if they become severe, they can be treated symptomatically. These include dizziness, headache, nausea, vomiting, diarrhea, tachycardia, nervousness, tremors, rashes, urticaria, pruritus, photosensitivity, elevation of liver enzymes, thrombocytopenia, eosinophilia, increased intracranial pressure, nervousness, joint symptoms, and agranulocytosis. Warnings are: ciprofloxacin should be used with caution in patients with known or suspected central nervous system disorders, renal impairment or hepatic disease, with a history of GI disease, especially colitis, or who have dehydration. Do not exceed the recommended dose. Take appropriate measures if secondary infections occur. High-risk groups are: drug should not be given to pediatrics, pregnant mothers, cardiac or hypertensive patients, patients suffering from kidney dysfunction, patients suffering from liver malfunction, and neonates. If prescribing authority justifies the benefits of the drug against a possible damages, he or she should re-evaluate them and consult the reference material and previous studies. Now, dosage: the adult dose for the ophthalmic route, the dose is 0.3% and the frequency is 6 hourly. And for the IV route, dose is 100 to 400 mg and the frequency is 12 hourly. As required, usually for 5 to 7 days. And for the oral route, dose is 250 to 750 mg and the frequency is 12 hourly. Now, some brands names: Novidate, Roxin, and Ciprocin. Thanks for watching and keep supporting our channel AI Medical School.